Good afternoon, everyone. Thank you for joining today's Lunch and Learn. We're about 1 minute before the presentation, so if you'd like, please feel free to put your name and the institution that you currently work at in the chat. We always love to know who's on these sessions, so that would be wonderful. And I think we're just about a few more seconds here, so I think I'll stop. Meredith, you all set?
I'm ready.
Okay. So hello and welcome to today's Lunch and Learn series presented by Kaplan. My name is Karen Haidaminas and I'm a nurse educative consultant with Kaplan. I'll be the moderator throughout today's presentation. Before I get started, I want to point out a few features of the Zoom room. Feel free to post your thoughts, ideas, questions in the chat for all attendees to view. We'll make every effort to answer any questions that appear. We'll also have some time for Q&A at the end of this presentation. We will be posting a link, which I put at the very beginning of the chat there, and I'll repost it again at the end, with an evaluation survey. Included in the survey is a certificate of attendance. So we hope that you'll take a few minutes to complete the evaluation of today's session. And as your feedback, we find very important to us. This session will be recorded, and the slides for today's presentation will be made available once the recording has been posted. You can access the slides and the recording on the registration page approximately 48 hours after this presentation. Topic of today's webinar is Transforming Simulation with AI, the New Era in Nursing Education. So today I have with me Meredith Ashley, who's my peer. She has been a registered nurse for the past 19 years, holding various nursing positions within the acute care organizations. She's been a nurse educator in the didactic and clinical settings for over 12 years. Meredith has served as a simulation director, course and level lead, program director, and department chair of community colleges in Central and East Texas. In her free time, she enjoys reading, traveling, and spending time with family and friends. So Meredith, I'll let you take it from here.
All right. Thank you, Karen. Thank you so much for everybody that has joined so far and those that are hopping on as we speak. It is my privilege to be with you all today and to talk about some of the new trends in nursing education, which we know are ever changing. So hopefully you all can see my slides on your screen, and we'll go ahead and get started. Again, as Karen mentioned, my name is Meredith Ashley, and I have been with Kaplan for almost 2 years. And been a nurse educator for the last 12. And I'm excited to present with you all today. So let's go ahead and get started. So here you'll see my objectives. At the end of the presentation, you'll be able to integrate some of the things that we're going to talk about into your everyday classroom and learning with your students to hopefully improve critical thinking and their clinical reasoning. AI has been a big hot topic in nursing education and just in anywhere. AI in general is changing a lot of what we do on day-to-day basis. So it's good to keep up with the trends in nursing education as well. And so that's what I hope you take away from today, ways that you can implement this, whether it be in the simulation lab, in your classroom, clinical, skills labs, however you can fit these in and into any level of education as well. What is AI? AI is an artificial intelligence computer system that's designed to mimic human intelligence. It takes tasks, learning, problem solving, decision making, while also using a natural language processor to develop tools or analyze data, recognize patterns, even provide insights into what you are wanting it to do. It can be used in nursing education in a lot of different ways. We see it in, sorry, I think I went one too many. Let me go back to this slide. Used in nursing education in a lot of ways, and we're starting to see this come more and more full circle as things are being developed and as we are learning more about how to use AI in the classroom and in our program. It does help promote, or it can be used to help promote critical thinking and clinical judgment. And we can use some of our old ways of doing things by having AI as an assistance. I'm going to tell you, the students, whether you've asked them or not, are already using AI and AI tools to help them through their nursing program. I have a couple family members that are currently in nursing school. And so every day I learn something new from them. So if you ever stop and ask your students, tell me some ways that you're using AI to help you, you'll be just appalled at the ways that they have come up with to use these tools. They can take your lectures and turn them into a podcast, which I found super interesting. Sometimes they like to listen to our lectures over and over again. There is a product through Google actually that will turn your recorded lecture into a podcast with two different hosts talking about what you talked about. It's fantastic. I can definitely share more about that later. But so there's lots of different ways that they're using it. So I think we ought to be in the trend as well and using it in our classrooms. So here are just some examples of how you can use it: generating a realistic case study or simulation, or even having your students using this as a flipped classroom activity, or while they're doing a simulation and waiting for maybe their turn in the sim lab, having them build a case study, or using it as a project and having other students complete their case study. Generating a visual aid for the nursing course, or even a lesson plan or study guide for your students based off of your lecture topics, recordings, or objectives, kind of like what I mentioned. With LM Notebook is a new one through Google that allows you to do the podcast thing that I mentioned. It also will create a study tool and a flashcards for your students. Then there is you can always do like a list of critical thinking questions, or you can even ask it to generate some NCLEX style questions, even NGN style NCLEX questions. So, for example, today I just kind of wanted to pop over to one of the well known AI databases, and that's ChatGPT. You can create a free account. So, this is a free resource that you or your students can use, and just kind of show you how this was used in some of the examples that I mentioned on the previous slide. So, for example, I just asked it to generate a realistic case study scenario with a 75-year-old male that was admitted to the hospital with CHF exacerbation and a history of hyperlipidemia and diabetes type 2. I wanted it to create labs and physician orders, and then have the students prioritize 3 top actions for the nurse related to the patient's current status. So, when I asked it to do that, it gave me this information, and I do have a slide coming up that's kind of got more of this information on there, but you can kind of see as I scroll down that it gave me the things that I asked it for: current systems, past medical history, vital signs, lab results, physician orders, top priority 3 actions that the nursing students should find based on that. And then I asked it to put it in a chart format and create 5 NCLEX NGN style questions to ensure students chose those correct actions. So here you can see it put in a nice little chart that I could copy and paste into a document if I wanted to, with the same information that was above. And then it's given me some NGN style questions here, kind of shown me the different types of NGN style questions, that they are multiple response. There's a closed question asking them to improve, worsening, and change. So even though we're not using a dynamic platform to maybe write these questions in, we still are seeing how we can, even in a Word document, write out some NGN style questions for our students to see and practice with. Here's a drag and drop prioritization. So here they're going to prioritize the correct order for the patient, and then a bow tie format as well as a trend question. So you can see it's made these questions. Now, AI is going to make mistakes. It is a computer. We know that computers are not 100% accurate. So you're always going to want to read through anything you're going to use AI for, and make any corrections before you obviously put it out to your students or anything, because it will even say down here at the bottom that it can make mistakes. So it's important to check. So then it gave me the rationales for the prioritization. Now it's going to ask me, do you want to refine any of these things? I could add in some of those details, but then I wanted it to include rationales with my questions and test taking tips. So you'll see that it rewrote the case study again for me. And then it gave me my same questions that I had up there, but it's listed now a rationale for the students, as well as some test taking tips that might be helpful for the students. So maybe this is one of the things that you want them to do. You've taught over a certain topic, and now you want them to use AI to kind of help generate some questions. And then this can kind of be a helpful study tool for the class to use as you're recapping a topic or developing a study guide for them. There's again our closed question. It's going to tell us what was right out of the three choices that they could have picked, and then the rationale and the test taking tip. Same with the rest. As I continue to scroll, you can kind of see those things. You'll notice that this is going to be detailed for each one, and they are very easy to copy and paste. It does paste nicely into a Word or a Google Doc if you needed it to. So then I said, generate a study guide for the nursing student related to CHF. So here we can see this is our nursing guide related to congestive heart failure. If I wanted to post this in my course after I've fact checked it and made sure that it's correct, I can see that it's going to give me the different types of heart failure, risk factors, signs and symptoms using a mnemonic. So it's helpful for students if they're just learning this. It's also going to put alarming or requires immediate attention, those need to know aspects of it, what could be the potential complications related to this diagnosis. Here's our testing and electrolytes and imaging that we might need, as well as nursing interventions, again, with a fun mnemonic for the students to be able to remember it with, medications used to treat CHF that they may see, and then patient education, again, another mnemonic. I remember my students always loved mnemonics. I loved mnemonics. And then again, they gave some practice questions, NCLEX style questions that are multiple choice for the students to practice with, and kind of going through there with the rationales included, test taking tips for the NCLEX, and then kind of a summary of that. You can see here it says, would you like to make flashcards or more NCLEX style questions to reinforce learning? We could do that. Or we could say, can you create a simulation to use in the sim lab with a mannequin related to the above patient? Here you can see the detailed simulation. It's going to give us the title, some learning objectives, some pre-brief. So what you're going to do before you start the sim, kind of give them maybe this as a pre-assignment or a ticket to the sim, and then your scenario progression. So your initial patient assessment, what that patient looks like, how you should set that patient up, medication administration response for the next 10 to 15 minutes, and then kind of student actions, what they should be doing after they've given the Lasix. Here's what you'd want to do with the patient, recognizing complications in the final 10 minutes. They should be reassessing vital signs, and then holding the beta blocker and notifying the provider. And then here are your expected student interventions, critical errors to watch for, and then some debriefing questions after the simulation. And then what's really nice is an evaluation criteria or grading rubric that you could use. And all of this could be modified if you wanted to. Once you've pasted it out of here, it can all be edited or modified. And then if you wanted to make this a little bit more interdisciplinary or add some different options that you could go with based on your student groups, you could do some different things here. And then your final notes, the simulation prepares students to assess, intervene, and prevent complications in CHF patients, reinforces NCLEX priorities, including fluid overload management, diuretic administration, and patient education. One thing that's really neat is you can then tell it asks me, do you want to do handouts, pre and post quizzes, documentation templates for this simulation? And you can say yes. And then you can just, I'm going to scroll through kind of quickly for the sake of time, but you can see here that it's given them all kinds of things that you could take and use in your efforts of creating this simulation. So it's a really great tool, and it can really help at least get the process started. Sometimes for me, the hardest part is just getting started. So this can really help get your creative juices flowing and innovative ways to use this platform to help cut cost, time, all the things can be helpful with this AI tool. Again, AI, whether it's in just general education or in your simulation lab, you can make those virtual patients like we just did in that example. Personalize the learning. Students can get personalized learning. They can have clinical decision support. So are you making the right decisions? Are we teaching them to make the right decisions? If they didn't make the right decisions, they're going to get that feedback there. It's going to help you with the grading as far as building those rubrics. Some of the platforms and tools that we have available now are able to actually grade these assignments for you, and you may be using some of those as we speak. You're obviously going to get some data off of those kind of platforms that they're capturing that data and learning how to help you analyze that. You might use virtual nursing assistants or telehealth, or maybe even a chat bot to kind of have a conversation back and forth to see if the student is grasping the concept. It can kind of interact with the student. So there's just so many ways to use it. And these are just kind of some screenshots of what we did in the chat GPT just a second ago. But it does adapt to scenarios. It does have that natural language processing so the students are able to see, and it's able to take whatever you're putting in and spitting back out that information. And it does give them a diverse clinical experience. The benefits of AI and in simulation or in the classroom can be increased student engagement. Students are really catching on to this AI trend, so they really really like when their educators are also on top with their trends and really engaged with those things. They're using it already, so we might as well. The immediate feedback really helps them while they're in the moment. We know that students can tend to delete and forget by the time the end of the scenario or the day has concluded, and they may not remember that they actually made that little mistake that could have been a potentially big error. So getting that immediate feedback really helps. And increased knowledge retention, they're remembering things as they're seeing it. It's really addressing a lot of those learning styles, and then improving their clinical judgment and their decision making, which is, we know, one of our goals with the new NGN style questions, as well as the NCLEX's overall goal. So this really can help with that as well. Here are just some platform examples. Again, I know that this is a small slide and has a lot of information on there. This will be available to you, like Karen said, in 48 hours. So check back if you're wanting to like try some of these sites and see how they can work in your simulation lab or in your classroom. But for example, I did link some here. Chat GPT, Perplexity is a good one. Copilot is Microsoft's open AI resource. Gemini is one that I use with Kaplan because we are a Google company. And so Gemini works with Google or is inside Google. And so it really helps to, when you're creating a PowerPoint, when you're creating an email, when you're creating a Word document, you can use a lot of these to help you. So when you get those emails, can you write me a letter of recommendation for this job? Some of these tools can be helpful in getting that template for you to kind of get your ideas flowing. There's also been a lot of strides in making AI in a lot of our LMSs, our learning management systems. For example, Moodle, Blackboard, and Canvas all have different ways to enable AI, whether it be through chat boxes or chatbots or adaptive learning strategies, branching case scenarios with automated feedback loops. Those can kind of help as be interactive for the nursing students and really help you in that interaction of AI into your classroom. These tools help create adaptive learning scenarios where students interact with the virtual patients. So whether it's ChatGPT, which is what we showed earlier as an example, the Watson Assistants and IBM chatbot for patient scenarios and automated feedback, and then chatbot.com and VoiceFlow also develop text and voice-based patient interaction training, so that can help with some of the students' communication struggles, or as they're learning to communicate as a nurse, that can help there. We at Kaplan have one that we're really proud of, and that's our Kaplan iHuman patients. We have it for both grad and undergrad, as well as some of our NP programs can use it as well. And so this is really great. It provides text and image-based patient scenarios with real-time assessment and feedback for the students. And I'll show you an example of that as we go through a few more of the slides. There's also some game-based simulation builders where you can kind of build a simulation into these platforms. Twine, Articulate Storyline are some that I found. And then Adobe has one called Captivate that's also can be interactive learning scenarios that will have the feedback loops. It gives them a more interactive case-based training based on decisions. There can be some issues with some of these, as obviously they're developing, they're new. A lot of these are in their alpha or their beta testing phases, which means that they're putting them out there for you to test and kind of give them some feedback on them. There are some they do some of these, especially these game-based ones, can take a lot of time, can be a little time consuming. They may need some customizations, but there are some that are pre-built and then you can just tweak them as you need to, kind of like we did with our even our chat GPT. We kind of got an outline and then we could go in and add to or tweak any of the areas that we wanted to. So this is going to show you kind of an example of our iHuman platform here at Kaplan. It helps with the AI powered conversations and scenarios. This is going to kind of follow that clinical judgment measurement model. The students are going to get to have an electronic record where they're able to see all of the different things on the patient that they are taking care of for this scenario or this case. We get to see a timeline, the orders that the healthcare provider has written, the notes, the progress notes. Here, the students can look in that electronic health record, whether it's their current visit or a past visit, and start to pull and identify the important things that they need to know before they go in and assess this patient or do a history on this patient. So this can be helpful in recognizing those cues. Next, it also does help improve their clinical judgment. It can help with the analyzing of cues, which is the second step in the clinical judgment measurement model. They're going to get to meet and communicate with the patient, take the patient's history, document the patient's key findings. What do they find is helpful? This is an interactive question base where they can type or voice speak the text or question that they have for the patient. It'll give them a list of questions that they can pick from, and then he's going to respond with his answer based on the question that they ask. So they are able to get some interaction with the patient in this, and then it'll tell them at the end, they'll get immediate feedback on each one of the sections, and they're able to see, oh, that was a question that I should have asked. This is a question I did not ask. This question was appropriate, and this question was really not necessary to ask. It didn't really have a benefit to my patient or the reason they were here. We can complete the physical assessment, listen to the heart and lungs with a stethoscope. They can take the blood pressure and pulse, document and interpret those findings. So they're able to determine based off of what they heard from the lung sounds, was that normal in the right and the left? Do they have any abnormalities? And so that they're able to start then think, okay, what do I have? What trends am I seeing? What's going on with my patient? They're here for X, Y, and Z, and I'm seeing this when I listen to their heart and lungs. How does that translate into what I'm seeing here? And then they're able to develop their hypothesis and prioritize it by grouping the findings into systems and concepts. So what do we think that this finding that we found relates to concept-wise or by body system? It helps them to document and make decisions and show their decision making in that. Again, kind of like we saw in the closed question on the example questions that we created in the chat GPT, here they're doing kind of the same thing. Are they seeing a change? No change? Is it worsening? Is it resolving? Or is it resolved? So they're able to kind of make some of those decisions here. And then when they submit their case findings and their answers, they get immediate feedback on that, showing how they did on each of those things. So it really does reinforce that loop of learning so that they can move on and understand going forward where maybe they are not understanding something or where they're getting it correct. They can generate solutions and take actions in the next few steps of the case study as they walk through the iHuman patients. They're able to choose appropriate steps for the patient and determine if those steps are needed to be done. Those actions need to be done stat, routine, or urgent. It does give them a list of what those definitions are. And then they can go from there and decide for their patient, is this stat, urgent, or routine? Then once they submit that, again, they get that immediate feedback to know if that was correct or incorrect so that they can understand moving forward and learn from that lesson. Then they can evaluate the outcomes. Students are able to review all what they have found throughout the case so far. document their findings, create an SBAR to their healthcare provider with the key findings and recommendations. Once they write it, then they will get some feedback immediately showing them what the SBAR could have looked like or maybe should have looked like. If they missed something, they can say, oh, now I understand why we added that. So these are very important as the student is able to interact and kind of build um, that pattern or that knowledge as they're going through and talking to patients, taking a history, doing that physical assessment, and then evaluating what all they have found in those steps. So this can be really, really helpful for students. We have tons of cases. We've done a new re-release for our undergraduate. We've got lots of cases for our graduate program. So if this is something that you're interested in, definitely reach out to your nurse consultant, and they can get you in touch with the right person to get you like a demo set up or a demo account so that you can kind of start seeing if this might be a benefit for your students. It's really a great product and something that I truly, truly believe in and love. So I hope that you will take that opportunity and look into that as well. And then that's kind of a summary of I want to make sure I leave time for questions, but here are some key references. Again, some of the Kaplan resources and the iHuman platform resources are here. And again, this will be made available and in a day or two. So check back to get this here. And that way you can check out any of that as well as any of my resources for my PowerPoint today. But I want to make sure I have time for questions. Are there any questions that I can answer for anyone? Feel free to type it in the chat if you want.
Meredith, the only one that we did have is they apparently liked the one showing the chest with listening to breath sounds. And someone asked if they can do that with AI. Can they create pictures?
There are some platforms that will allow you to create pictures. ChatGPT is not one of the greatest ones for image building, but there are some great ones for image building. So if you search AI platforms that do image building, it can really help you develop even a study guide or a like a one sheet reference for, like, for example, for CHF that you might want. So that can be a really great resource. There are some that will beautifully do images, and that's kind of their whole thing. I did it a little bit with ChatGPT and I got some really misspelled words on my image. It looked very distorted. So again, ChatGPT is not known for its image building, but there are some great ones that you could build images on. But I do know that we at Kaplan do have a great set of imaging with our patient. It does come with this. This is what you'll see. The students are actually seeing this with the patient. They can turn off or leave these on for the anatomical locations of listening. But it is a great resource to show that physical assessment and history taking lesson that it's really hard to capture sometimes. You know, one of the things I see a lot is using AI or these iHuman patients for things that you may not typically have control of the student seeing in a clinical experience. For example, maybe you want everybody to see a complicated labor and delivery birth, but you can't guarantee that every time. We want them to see a birth period sometimes. And so, or pediatrics may not be vast in your area for experiences with your students. I know that's a problem where I live in Texas. And so this can kind of help supplement some of those areas where you may not get those experiences.
There was one question, if you see it there, Meredith.
Yeah, can students take their PowerPoint to make study guide and NCLEX questions? Yes, they can. And that LM notebook that I mentioned from Google is really a crazy product. I was sitting there and going through it and was amazed when I saw my niece had recorded a lecture of her professor while they were in class, like to listen to over and over again, because as she's driving, she will. And then she uploaded it to this LM notebook and it made it into a study guide, it made it into flashcards, and it made it into a podcast with two different podcast hosts. And then she could actually buzz into the podcast and ask a question to them, and they would answer it based off of what they generated from the lecture. So it was completely mind-blowing. It's really amazing what all you can do with all that. So yes, they can make all kinds of study guides and NCLEX questions. And same thing here with the ChatGPT. It's really easy to kind of, maybe it would be a good way for you to start give you a template to writing test questions and test item writing. So definitely check it because it's got some flaws. It is a computer, so I do like to make sure you all understand that, but it can be a way to get your juices flowing. So any other questions? Nicole, it looks like you raised your hand. I don't know if you want to type your question in. Do you have anything? Again, Karen mentioned that this will be available in 48 hours. So if you want to grab this PowerPoint, I cannot hear you, Nicole. I think it mutes you because of the size of the audience. So if you want to type it in the box, that would probably be the best way. I will also put my email address in here. If you have any questions or need anything, you're welcome to reach out to me or to your Kaplan nurse consultant. If you don't have one, we would love to connect with you and see if this can be a resource or we can help you with your institution. So feel free to. Will ChatGPT make pictures? It can make pictures, but it can be a little iffy. So if I ask it to make a visual guide, you'll notice when it does this, it kind of, well, it's going to do this. Okay, I'm going to generate an image for CHF. It will kind of, it'll do this and it'll look, oh, good, it's going to come up with something great, but it's not the best platform to generate images. There are some others that are better. And you can see it's got this, but it's got some weird, short of who knows what that word is. So it's got some weird things. I don't even know what that word means. And so it's got some weird things that it puts in there. And so it's not one of the best ones. It's better at doing linear wording, those kinds of things. But it will get you started so you can kind of get an idea, or you can use one of the other platforms to generate an image for that. When you say PowerPoints, do you mean PowerPoint that the instructor has provided for them? Yes. So a lot of times, like if you're sharing your PowerPoint with your students in PDF or in PowerPoint format, they can upload it to this LM notebook, and LM notebook will take the information that you've given them and give them flashcards or a study guide or things like that that they can use to study with. It's really great for those that maybe don't learn the traditional learning ways. They need that hands-on or that kinesthetic learner. And so this can be helpful, especially with the podcast. Those audible learners really like that dynamic of that. So can really be helpful for those. LM Notebook is the platform, and it is within Google, actually. So Google is the, I guess, host or owner of that notebook, and it is a newer resource that has come out. Yeah, absolutely. Any other questions?
Just as a reminder too, you saw throughout the presentation, there is an evaluation. If you could take just a few minutes to fill that out, we would greatly appreciate it. You'll also get your certificate of attendance for this.
Yes, and y'all have been a great audience, so I appreciate all the engagement and questions.
Thank you, Meredith. Sometimes I think we don't even know what questions to ask yet because it's so new.
Such a new
And that's
topic.
okay.
It is. It is. It is. Well,
Ask
yes,
your
so,
students.
yeah, they are wonderful teachers, so it's very interesting. So play with that LM Notebook, turn your lectures into a podcast. It's really interesting. So I'm glad y'all enjoyed it, and feel free to reach out anytime to your nurse consultant or any one of us here. So
Great. Thank you, Meredith.
thank you.